Hello, we are Group 7, and our topic is managing the recent influx of asylum seekers. In order to understand the common health needs of refugees and migrants, we first have to understand who these people are so that we can cater to their needs. According to the World Health Organization, there are more than 1 billion people on the move, and from this number, 281 million people are international migrants and 84 million are forcibly displaced. This number is expected to grow due to poverty, lack of security, lack of resources, and services. In order to understand what a migrant is, we have to first define who a migrant can be. A migrant is defined as a person who changes their country of residence and includes people that are moving or have moved across an international border. Due to this title, they often face limitations in various aspects. Therefore, it's important to identify their specific needs so that they can gain access to them and improve their standard of living. So, common health needs of refugees and migrants include water, food, clothing, sanitation supplies, healthcare access, maternal care, mental health services. Since migrants and refugees are constantly on the move and have been traveling for some time, usually walking, they don't have access to water and food. And if they're traveling into a harsher climate, they may not have the proper clothing. They may also lack healthcare access and sanitation supplies, such as women having periods, they may not have access to pads or tampons. If they are pregnant, they may not have access to maternal care or a place to give birth. And since they may be traveling from a place of wa- um, political conflict, they may have various mental health illnesses like depression, PTSD, and anxiety. So, common vulnerabilities of migrants and refugees include discrimination, substandard living, xenophobia, restricted access to healthcare, low levels of health literacy, exclusion from disease prevention, exclusion from health literacy, from health services, unsafe housing and living situations, more vulnerable to abuse and trauma, lack of financial competency, and lack of interpretation.
So now we're going to discuss how we would advise New York City officials to ensure that healthcare, education, employment, and housing needs of these migrants are being addressed without compromising the welfare and social services to the residents of the city. So to start off, let's discuss what the city already has in place to support migrants. For healthcare, there's NYC Care that provides low or no cost health services to all New Yorkers, regardless of their immigration status. There are also health and hospitals, which offer comprehensive health services, ensuring that no one is left without essential medical attention. When it comes to education, the DOE ensures that all children, including migrants, have access to education through programs like ESL and bilingual education. There are also community schools that offer additional support services like mental health counseling, nutrition, and after-school programs. For employment, the Department of Labor provides access to training programs, career counseling, and employment services through something called Workforce One Career Centers, which assist migrants in finding suitable employment opportunities. The services provided are of no cost and do not require in-person visits. Also, the DOL partners with community organizations and employers to develop vocational training programs tailored to the skills and needs of migrants. For housing, New York City Department of Preservation and Development offers affordable housing and support services addressing the housing needs of low-income families, including migrants. Homelessness prevention programs like Home Base provide housing assistance and counseling to families at risk of homelessness. While there are lots of initiatives our city has in place already, there's always room for improvement. So in healthcare, we could deploy more mobile health clinics to reach underserved migrant communities. This would reduce the burden on hospitals and emergency rooms while ensuring that healthcare is accessible to all. These clinics can offer essential services like vaccinations, primary care, and mental health support. Establishing partnerships with local universities and medical schools can facilitate volunteer programs where medical students and professionals provide care to migrants, which would help reduce the strain on city hospitals and clinics. Implementing telehealth services can also expand access to healthcare for migrants, especially for those who face transportation barriers. For education, we can invest in more comprehensive ESL and bilingual education programs to enhance migrants' ability to integrate and contribute to society. We can also increase the availability of after-school and summer programs to aid in the learning and integration of migrant children. In addressing employment needs, creating job training and placement programs tailored to the skills and experiences of migrants can help them integrate into workforce effectively. Collaboration with local businesses and organizations can facilitate job opportunities for both migrants and residents, fostering a more inclusive labor market. This collaboration can also be done to create job fairs and networking events. Housing is a critical area where balanced resource allocation is needed, so establishing temporary shelters with basic amenities can provide immediate relief to migrants. At the same time, increasing investment in affordable housing projects and offering rental assistance can ensure long-term housing stability for both migrants and low-income residents. Offering incentives to landlords who rent to migrants, such as tax breaks, can also increase the availability of affordable housing. To ensure that these efforts do not compromise the welfare and social services of current residents, there needs to be collaboration among government agencies, non-governmental organizations, and community groups, which can lead to more efficient and effective resource distribution, ensuring that both migrants and residents receive the necessary support. Regular assessment and adjustment of policies and programs based on feedback and outcomes can further optimize the city's response, creating a more inclusive and resilient community for all.
Here we'll be talking about our roles as nurses and the development of health policy. And so the development of health policy refers to the steps in which through a health issue moves from being a societal problem to becoming an actual health problem that can be funded, implemented, and evaluated to eventually turn into resolutions. So 4 steps that are involved in this are identifying the issue, legislative process, bill to law, and regulation development. So first, with identifying the issue, we have problem recognition, where health issues are identified as societal problems through various channels, such as public awareness, advocacy, and research findings, and public and political intention, where the issue is brought to the attention of policymakers and the public through media coverage, advocacy groups, and community pressure. One important thing considering at federal level, only members of Congress can officially introduce legislation, and thus that Congress member becomes the prime sponsor of that legislation. And then it goes through the legislative process, which includes initial analysis that takes into consideration of public perception, problem definition, societal consequences, and support and opposition, which mainly includes stakeholders that are composed of members of Congress, special interest groups, business leaders, and the general public. And then it goes into a draft, which includes sponsorship, where a member of Congress, which is the prime sponsor, introduces the bill after thorough analysis, and drafting, where the sponsoring congressperson drafts the legislation, often with the help of the congressional staff, who translate the policy option into legal, technical, and constitutional language. And then the bill gets officially introduced to Congress, where it undergoes various stages of scrutiny, including committee reviews and debates. And then the process from bill to law, it includes legislative process and enactment. And legislative process includes committees that hold hearings, debate, and possible amendment to the bill. And then floor debate, where the bill is debated and voted on in both the House of Representatives and the Senate. And then it goes into enactment. So it would need presidential approval. So once both chambers pass the bill, it is sent to the president for approval or veto. And then once it's signed by the president, the bill becomes law and is enforced by the relevant executive branch departments. And then regulation development includes regulations that have drafting, public commentary, and then finalization includes review and implementation. So drafting regulations, where the relevant executive branch department drafts regulations that define how the law will be implemented. And then public commentary are public hearings that are held to gather information of feedback and any suggestions that can make the policy better. And then finalization includes review, where all comments and suggestions are reviewed before finalizing the regulations. And then implementation is where the final regulations are published and guide the implementation of the law. So this is when it will officially be enforced to the public. And so it's very important to recognize our influence as nurses with health with the development of health policy. So recognizing a health issue to implementing a solution involves multiple steps and stakeholder interactions, from identifying the problem and drafting legislation to developing regulations and enacting the law. Each stage is crucial for ensuring health policies effectively address societal needs and are reasonable. Thus, nurses in leadership positions must be knowledgeable of the legislative process to be involved and make changes to policies that affect patient care and health accessibility that augment overall health and well-being, particularly for people facing health disparities. Thank you.